Good evening. Welcome to today's Heartfulness Wellness webinar. The topic for today is Care for Cancer, the journey to preserving and nourishing. I'm Viji Balasubramanian, and I will be the host for today's session. This is a topic that is very dear to my heart and comes as somewhat as a puzzle to some people as to what could be the relation between cancer and COVID, as the virus really has no bearing on this disease. In Heartfulness, which all of you know by now, is we offer meditation for health and well-being. We offer a focused program for cancer patients, a program of support, a program that fosters peace, courage, and inner resilience during the challenging times that patients face. In the past week, we've had many phone calls from many people amidst many concerns, anxiety, worries about their own disease, treatments, and progression. With that as a framework, we offer today's session. And joining me on this webinar today are two wonderful people, professionals who work very hard to enable people with this disease to fight very gently and powerfully for their own healing, recovery, and wellness, with the intent of helping them lead fuller and meaningful lives. I'd like to introduce Dr. Suma Premkumar first, a senior radiation oncologist trained at the renowned Adyar Cancer Institute in Chennai, a very astute physician, recipient of many awards. Personally, for me, I've seen her interact with many patients, and her strength is the care that she offers each one of them, counseling them when they are at their lowest point in their lives, asking them to be courageous and look at their weaknesses and integrate their own learning with the treatment, the mainstream treatments that she offers. I've seen many patients leaving her office room with so much of hope and resilience in their hearts. Along with the conventional medicine that she offers, radiation, chemo, immunotherapy, she advocates yoga, meditation, and nutrition as good support practices during treatment and after. Welcome, Suma. We're very happy to have you here with us today. And hi, can you hear me? As she gets settled in, the next person that we have on our webinar is Luke Coutinho, a holistic lifestyle coach, needing absolutely no introduction on this platform. One of the top names in the field of wellness, health, and integrated medicine. Also one of the first health coaches in India to help cancer patients build robust immunity and works with them through any treatment modality that they choose. I have interacted with many of his patients all over the world and have been fascinated by their integrated approach. He also is a strong advocate of relaxation, meditation, prayer. Heartfulness has had the privilege of integrating meditation in his own coaching. I like to call him the rage of the town, but I think he's definitely here to stay. Luke, welcome. We're very glad to have you here with us today.
Thank you so much, and welcome Dr. Suma as well.
So today, the three of us are a triangle here. Each one of us bring our own offerings to patients in a very integrated manner. And for this reason, I'm extremely grateful that we could come together in this space during such a challenging time. We have some very specific questions from patients also, and both of you are experts, and we'll just go round robin and get your views on them. I'd like to start with Dr. Suma. This is a very challenging time for cancer patients, especially the ones who've been recently diagnosed, just got a chit on what they may be suffering from. They don't have a plan, a treatment plan in front of them, and every day of the lockdown is very agonizing for them. what is the approach, the medical approach to such patients? How are you supporting such patients? What can you share for such patients who may be listening in?
Dr. Viji, this is basically when you are coming with with a lump in the breast, example, okay, and you have undergone investigations like a biopsy, which confirms it that is malignant. Yes, there are certain investigations that have to be done. But unfortunately, during this COVID time, mammogram and ultrasonograms have been they're not doing it regularly nowadays because it's going to be hands-on the patient and they need to have the PPE and everything in place. So certain centers are providing other investigations like a PET-CT scan. So actually, once the diagnosis is done and we are able to clinically, we can judge what is the stage of the patient. Depending on the tumor size and everything else, we can judge for a breast cancer I'm talking about. If it is going to be a lung cancer patient, then it needs a PET-CT scan, then we have to stage everything. So we have to do it. Different cancers need a different kind of evaluation. We can do it right now with certain centers which are available right now, and we can go ahead with the treatment. But then there are some guidelines now. Right now, we have got some guidelines from the ESMO, from ASCO, and from ASTRO. All these organizations have given us a guideline, and based on which we have to tailor the investigations and treatment with each individual stage of the disease. So if it's going to be an early stage of the disease, naturally everybody is going to wonder, okay, I've got the cancer. Now, if I don't take the treatment immediately as it is in the early stage, will it grow further within a month's time? That will be the first question in their minds. We can put this off and say, we can give them during this time also, we can give them the treatment required, like radiation can be given, chemotherapy can be given, but radiation treatment is also going to be prolonged treatment. So we have to give the treatment based on the patient's condition again, if it warrants it or not. So if we can postpone radiation and give the chemotherapy, which is going to be once in 3 weeks or so, that will be ideal for the patient. So you give the chemotherapy and then we can go ahead with the radiation as the 2 chemotherapies, with the 2 cycles of chemotherapy finish, and then we can take it for the further management. So each patient, we have to see what is the stage of the disease and accordingly advise them. The treatment can be given for the patient. There is nothing like there is going to be a delay in the treatment. The patient can be reassured that he or she is going to be taken care of, even in this COVID situation. But there are certain situations like in COVID-19, you have given social distancing, and then they have to wear the mask, which is all advised. So these kind of things which we are going to advise them, they have to follow. The distancing is advised. We are doing it, carrying it out in the hospitals. And similarly, we are advising them to wear masks when they are coming for their treatment. It need not necessarily be a surgical mask or an N95 mask. Any cloth which can cover the face, the nose, mouth, and most of the face, that will do. And frequent washing of their hands or using a hand sanitizer, that will do. So we are giving them all these advices along with the care that the patient's attender has to be minimal. The patient's attender is, we are allowing only one attender per patient and not many. So we are restricting everything over there and then giving them the treatment. So actually the treatments are not getting delayed. We are giving them some form of treatment. This is what your question was regarding the newly diagnosed patients. So this is what we are doing for the newly diagnosed patients. In a case where there is a breast cancer and I'm unable to do these mammograms, I just go with the PET-CT scan or whatever CT scan that can be done. We can do a CT chest and a CT abdomen that will help us in evaluating the patient and then going for the treatment further. So we are just modifying certain investigations so that the patient can be evaluated and then treated too.
That's very
patient
important.
Can be reassured regarding this thing. Yes. They need not worry that they are going to be having any issues during this stage.
So that's very important from the clinical point of view, the clinical setting for all of our patients who are tuning in, that medical fraternity is taking the required steps of revisiting protocols, you know, mixing and matching what is possible, what is enabling at the moment, and really keeping your own, the patient's treatment at heart, and catering to their needs. So you're not going to be left just that way, even though we are in the midst of a pandemic or a crisis. So that's very reassuring from the medical fraternity. Luke, I would like to ask you, I mean, we've been following you for quite a while now, and you've been a big proponent or advocate of immunity even before the COVID pandemic. And all of your cancer patients have been coached on immunity quite a bit, on how to build immunity. Would you like to, for our viewers, would you like to touch a little bit on the basics of immunity, or whatever you would like to share with them about how it helps during their treatment and further on?
Sure. Yeah, sure. So just to, add to what Dr. Sumana said, it is very reassuring because all our patients now who are undergoing chemo and radiation, it's reassuring to share that none of them have been stuck with this. The medical fraternity has handled it so well. I don't have a single patient who is in a crisis situation where they're unable to get their treatment right now. The fraternities come together, done modifications. So I think it's fabulous. I don't have a single patient. In fact, there are other countries where I have patients and the situation is way, way worse because they're going through so many inflow of patients. But I think in India, touch wood, people should not worry about that. There is treatment when they approach the fraternity. I've not seen a single delay or a compromise in that. So full respect for the medical fraternity over there. Now, coming to immunity, I mean, it's the first and last line of defense in the human body. It's what's always got my interest in health. That how can this amazing human body have so much of intelligence to fight germs, bacteria, pathogens on a day-to-day basis, on a second-to-second basis. And when someone is sick, when someone is infected with a virus or a bacteria or abnormally functioning cell, like in the case of cancer, what has caused a defect in the immune system that has allowed these cancer cells to actually, multiply and spread and behave abnormally? So that's always been my interest. And when I look at the human body as a whole, what I see is a very complicated and intelligent system that requires a very, very simple action plan to maintain a good immune system. So, when we talk about immunity, people immediately think it's very complicated. Of course, you break it down into immunotherapy and immunology, the theoretical part of that will seem very complicated because of the big words and neutrophils and macrophages and phagocytes and all of that stuff. But when we really look, what does the immune system require in a human being to run the right way? You need the right quality and the right quantity of nutrition. Because every cell grows and lives and survives on oxygen from the air that we breathe and nutrients from the food that we eat. If a cell is able to get the right amount of oxygen and the right quality of nutrients, the mitochondria in those cells will break it down into ATP. The amount of ATP we produce moves into energy. And it's just a beautiful system. I'm not going to make it too complicated, but if it gets the wrong quantity of oxygen and it gets the wrong nutrients from the cells, the basis of the cell cannot function the right way. Its own weakness starts getting more and more amplified, which is why we tell people the wrong diet will actually drop your immune system after a while. So, the four pillars that I call to build a strong immunity, and it's applicable to every disease, be it cancer, be it diabetes, is number one, the right nutrition for you. Okay, every individual is unique. Sometimes we see people who require more protein than other people. Some people can do very well with carbohydrates. Other people, carbohydrates will make their sugar levels spike. Everyone's different. What is the right nutrition that your body type requires? Quality nutrition. Second, what is the right exercise that's required? Today, medical science is showing us that almost 60% of cancers are caused by poor lifestyle. And when they further break down lifestyle, it comes with sedentary lifestyle, junk food, lack of sleep, heavy chronic emotional stress. So if I can fix exercise, if I can give my body the right amount of movement, let me not even use the word exercise, because sometimes exercise, people think only about gyms and lifting weights. No, movement. If you're moving and you're not sedentary, it's required for your immune system. Blood circulation. The more our blood circulates, the more we can carry oxygen and nutrients to trillions of cells in the human body. Then our sleep. Our sleep is so important. We all understand that all healing, all rejuvenation of cells, reduction of inflammation, detoxification of the liver, maintenance of acid levels, it only happens while we sleep. It doesn't happen while we're awake. So sleep is critical to boosting good immunity. And then, of course, where the heartfulness part comes in, there's a reason why all of y'all speak and coach every one of our cancer patients around the world, because the emotional part of it has to be fixed. With Dr. Viji, today I have patients who are physically fit, fantastic bodies, fantastic physiques, eating organic food, exercising every day, but they are chronically emotionally depressed and they get cancers. At the same time, because that impacts their immune system, I also have Vipassana teachers, I have yogis, I have people who have emotionally evolved. Yeah. So emotionally evolved, they can't be stressed, nothing like that. They know how to handle stress, but they physically neglected their bodies, and they come with cancers as well. So immunity is necessary for everyone, irrespective of your caste, your color, your creed, your designation, your bank balance. Everyone needs a strong immunity. And I believe that if we're able to support this intelligence with simplicity, we don't need superfoods all the time. We don't need complicated meditation. We have to learn how to relax. When we're relaxed, our immune system automatically gets better. When we're stressed, it isn't. It's really very, very simple. And as you would have seen in a lot of our cancer patients, our plans and our protocol is so simple. We don't even want people to eat superfoods, because for me, someone having an Indian garam masala in their food, for example, is a superfood. It's got spices. It's got so much of goodness that the immune system requires. So it's really about breaking it down, and immunity is the first and last line of defense in the human body. We learn this in anatomy class every single year, and for that, we need to give the body what it needs. Now, when we talk about building strong immunity, I like to focus on what destroys immunity. It's easier way to look at it that way. Now, at the time of the virus today, a lot of people don't get bare essentials. They don't get certain foods, and they're worried, Luke, will my immunity fall? I'm like, no, people, when you go back years and years ago, they lived on very simple dal chawal and had great immunities. But let's look at what can destroy your immunity. So in this lockdown, if people are overdoing it on sugar, junk food, which is providing empty nutrition to them, that's the easiest way to start lowering your immune system. If you're sleep deprived during lockdown right now, you will lower your immunity. If you're emotionally stressed and fearing anxiety, all of that stuff, and you're sitting at home watching Netflix whole day and you're sedentary, these are ways that your immune system is going to fall. So just by doing the opposite of that, we can maintain a strong immune system while we're going through this. Of course, cancer patients, they have certain deficiencies, certain vitamins, certain minerals. We need to put that back in through their food. We need to encourage them to take small steps. If they can't do a 1-hour walk, but they can walk around for 5 or 10 minutes. There are little things, little lifestyle changes that everyone can do right now, whether you have cancer or you don't, to keep your immune system strong.
Wonderful. Thank you. You knocked off a couple of my questions because you answered all of them already. But
we could go into detail if you need to on those points.
I think it's very reassuring for anybody who's going through a challenging time to hear this. And for those who want to figure out how to improve your lifestyle, which you're eating, sleeping, you can look up any of Luke's videos on YouTube or his live sessions on Facebook. The question I wanted to ask again, since in Heartfulness, we really look at the emotional angle and support the emotional side, is if somebody doesn't have access to fresh fruits or fresh vegetables during this time, should they be panicking because they feel that their sustenance is based on eating something fresh? And should they be worrying? Should they be panicking at this point?
Absolutely not. Absolutely not. When I look at my patients in Mexico, the staple diet in Mexico is rice and beans. Oh. And most of us have rice and pulses available right now. Correct. They eat very, very few fruits. This is in the poverty-stricken areas in Mexico where we did a lot of work with cancer patients. Mm-hmm. And we must not think, I know the media makes us believe we need to have 5 portions of fruits in a day, 5 portions of vegetables. It's good when we have it. But the beauty of the human body, the ability to survive, is phenomenal, phenomenal. I have patients in villages, cancer patients, who cannot afford fruits like urban people can. They are going back and eating khichdi and rice and dal and a little bit of moringa leaves from the tree. And they are doing fantastically well with immunity and with their diet and their treatment at the same time. So I don't think people should be scared if they cannot get fruits and vegetables and do all of their juices, which we don't recommend because we want your food not to be very raw when you're going through all of these treatments. But please don't worry about that. We have a lot of patients who have dal and rice and khichdi. The day they get fruit, they consume it. They don't have it. They don't have it. They are absolutely fine. So please don't worry about that.
Wonderful. Very reassuring. Sumana, I'd just like to go back to one thing. This a person who's recently diagnosed and they have this fear or worry. We had a call about 10 or 12 days ago from somebody who'd been recently diagnosed, and every time she went to sleep in the night, she just had this visualization in her mind of how the tumor is growing again and again and again, larger and larger, because there's no access to any treatments. And you brought up that also in your opening statement when we started. So we've been working with her online using the heartfulness relaxation, which we will see at the end of this session, as to how she can hold herself in a space where she doesn't visualize the negative effect of not getting treated. So there's something, and this is a whole field of medicine by itself, the mind-body connection. And with heartfulness, we introduce the heart too. So we're talking about the mind, heart space, and the effect on the body. And both of you are big proponents of this on healing, recovery, and just leading very healthy lives. So Sumana, I was wondering if I could first have you explain or give us an insight into how this mind, heart, body medicine works and what you can help our patients who are listening in with this field of medicine.
You know very well how I look at it. Okay, see, to me, the cancer is due to the mind. It is more of a mind and body connection. So I always look at things when I look at this kind of what kind of cancer, what is the situation that they have got themselves into. Like what was when 2 days back I had a patient who had gingival sulcus cancer. So I was asking him a lot of questions. What kind of work were you doing? What are your habits? And how many children do you have? And all about his family, his personal history. He was asking me, why are you asking me all these questions? Nobody asked me all these questions. I said, no, I have to know what are the reasons that you have got this cancer. What could have been the causes? It is, yes, genetics is one of the reasons for you to get cancer. Yes. But then again, there are so many other problems. Your ability to communicate with others, your ability to, put out all your aspirations and make it out in the life. Certain things you want to speak in each area. I always connect that this has got a problem with this. So oral cancers, I always think that they stop where they are supposed to speak. They chew, but they do not swallow it, and they keep it in their mouth itself, and that causes the changes in the oral cavity. And that is why I told him, see, you have bitten it, but you are unable to swallow it or spit it out, and that is what has caused this cancer for you. And then he came out, his son is a physically challenged person, which he started emotionally getting upset about the whole thing, and his son was next to him standing there. And I said, see, this is not the way you look at life. Your son is now working, he's earning 1 lakh per month. So what is it that you want to feel bad about? Now he's doing well in his life, so you be happy that he's doing well, and don't think that he has he is physically challenged and he's going to be, how am I going to leave him in this world, and how is he going to have a family, and how is his spouse going to accept him? All these things, you just leave it like that you have made him such a independent person, and he's able to care for himself, and he's able to bring you for a treatment too. So you be thankful now and start taking the treatment. So that will be the best way you can do, I told him. So I told him to look at things in that way, and then I started, this is how my connections, I do my connections. So each person, I draw the connection, and then I tell them, this is how you can change your thought patterns. I always say the thoughts are what are causing the disease. That disease is because of the thoughts in your mind. So what are the thoughts that are causing? So it can be anything. It can be an aspiration which I have kept in my heart, which I'm not able to release. So each area has a different thing. Urinary bladder, I associate it with the anger. And liver, I associated with resentment, lot of resentments. Lung with the freedom, they don't have an expression, not only expression, they are like, okay, let me die or let me stay, let me go, let me be there. Throat, yes, expression, creativity, there is a suppression of the creativity. Breasts, of course, it is love. They always aspire for more love. Heart, yes, they do not allow others to love them. So that these are the reasons how this is how I associate these kind of this disease, and that is how I teach them how to change their thought patterns. It is not easy at all. Each
Yes.
person is different. Each individual reacts to you in a different way, and you have to with the flow rather in these cases. So I always assess, I talk to them, and I find out which way I can guide them and how I can mold their thoughts if I am able to do it. Certain people do not, they do not understand this concept. They just want you to give the treatment and move on with the whole thing. They just want the chemotherapy, the surgery and the radiation. That's it. After that, that's not none of our business. We can never change those kind of people. I let them go. It is not my thing to hold on to them and try to change them. But certain people who are there who want you to take care of them, I try to guide them. So mind and body connection is an important one. I always say that.
We have a little bit of a freeze here, but it's fascinating what she's brought up. And Luke, as she's coming back on, I was wondering if you could give us your views, because you come in the mind heart space. I've seen your patients again and again and again.
Yeah, no, first, I'm so impressed with what Dr. Sumana said. I just love her. Just right now, I just love her. I mean, it's unbelievable. In my entire career, I've come across, like, she may be one in
have to take care of the mind,
okay,
take care of a healthy mind and a healthy body.
Wonderful. Wonderful. So Luke is just going to express his feelings for what you've just said. Luke,
Dr. Sumana, I have so much of love and respect for you. It is so rare to find someone like you who actually tries to find out the root cause of the cancer and link it with an emotion. And I have so much of respect and love for you just hearing you speak just now. It's just gotten me so excited, because if I have to put a percentage right now, you know, we spend so much of time diagnosing with our patients what the possible root cause was. And 99% of our breast cancer patients, we have established a link. Not we, the patient has, by us questioning them. It could go back to child abuse when they were small. It could go back to betrayal in love. It could go back to affairs, ugly divorces. And then, you know, the patient themselves say, we never want to put the idea in their head. They say that, Luke, you know, I think around this time, this is the time I started feeling uneasy in my body. My health started deteriorating. Because my first question to any cancer patient is, what was going on in your life 6 months to a year before you got it? So we take it back there, and it's incredible, the emotional connect we get. And of course, cancer is multifactorial. The emotions definitely have a connect. Like you said, breast cancer with love, throat, all of our throat cancer patients have been unable to express. I've had a lady with a cancer around the eye area, and she was never allowed to see things the way she wanted to see. She was always beaten into perception by her parents, and it's unbelievable connection. But I want to start with a little story about just before a lockdown. I had a 75-year-old breast cancer lady who walked in with her family. And before that, they called me out and they said, hey, Luke, she doesn't know that she's getting chemotherapy. She thinks she's just getting an IV, you know, for salts and stuff like that for her energy levels. This 75-year-old lady was on her 19th cycle of chemo. She came in smiling, no signs of ever having gone through chemo. She was laughing, no nausea, no whatever. And in my mind, like, she doesn't know she's getting a treatment. She has no fear. She has no knowledge about it. And it was just the most unbelievable. Like, for 75 years old of age to go through 19 cycles of chemo, we know it's a rough thing. There are going to be side effects. The body is fatigued and weak. but this lady was unbelievable. So it just shows us the connection of the mind with the body. And what we do for our patients is when they're going in for chemo or radiation, myself, our coaches, we teach them how to visualize. We say, as the chemo is going in, as you're getting the radiation, we need you to close your eyes, take a deep breath, and visualize that what's going in for you is actually good for you.
Yes.
Don't see it as a negative.
Yeah.
Look at it as, killing your cancer cells, building healthy cells around you, building your immunity, your hair is going to start growing. And you won't believe the outcome of these patients. They have minimum side effects. I won't say zero, but they have minimum side effects when they use visualization, they relax, and they accept their treatment. Because so many people come in and their only questions are the side effects of the treatment. Is my liver going to fail? Is my kidney going to fail? And we have to say, don't even think that. If you're going to start thinking that, that's exactly how the outcome of your treatment's going to go. But you need to think different about that. For that, we need them to relax. And that's where the whole meditation, the relaxation comes in, because a mind can only think and visualize when it's in a state of relaxation. When it's in a state of fear and anxiety, two things can't happen. You can't relax, and two is you can't make an action plan. All your action is out of fear and reaction. So the mind-body connection is by far, you can't compare it. Chemo has its own job. Nutrition has its own job. So we're not here to compare, is chemo better than nutrition? Is nutrition better than chemo? Absolutely not. You can't compare them. But mind-body connection and the emotional impact of a disease, and considering the emotional impact of the disease, is such a powerful drug, because the human mind is such a powerful drug on its own.
Yep, very, very well put. We had a patient once who would tell me that every time she went for chemo, she thought that the medicine that's coming down the IV was prasad. So anybody who's viewing in from outside, prasad is sacred food offered in temples. And she just thought of it as prasad every time, and she's been going very strong. And what we do, and both of you see, when the space that I come in, Heartfulness comes in, is we talked about the mind, the body connection. And like you said, you have to be in a relaxed state. And also there has to be a certain sacred silence within you, to eliminate all the chatter, all the negative thinking that actually nourishes you. And that's why the topic of today's webinar is a journey in preserving and nourishing yourself, because you have to learn to do it. We are resilient. We have all of it inside, but we have to bring it out. We have to learn how to do it. And this is a fantastic integration of the three platforms: mainstream medicine, lifestyle, holistic health coaching, and the heartfulness support, nourishing silence in the heart that enables the patient to really do this. The last question I have before we go through a session, and again, it comes to the mind-body medicine, and I'd like both of you to address it, is there are people who are almost done with their treatments. They're either on maintenance or they're in remission. But right now, they're really worried because they know that their immunity is lower compared to the rest of the walking population. I tell them that if they've done it right, their immunity is actually better than people who are walking around. But they have a fear that the immunity is lower. And during the time of the COVID pandemic, somebody has to step out of the house to get supplies for them, groceries for them. And they're so worried that they are going to contract this and they're not going to be able to fight this as effectively as others. So Luke, from your point of view of immunity, and ma'am, from your medical standpoint, Sumana, if you could blend this together, we'd be in a good space for this session.
Vijit, Luke has already told about the immunity, okay? And he has spoken a lot about this, nutrition improve the immunity. Yes, once they have finished the treatment and they are now under remission. So what are the studies that we have now from China? I don't know if you have gone through the studies, okay? They have seen how many cancer patients have had this COVID. They have been infected by this COVID-19. And it has been, out of 1,590 patients, 18 patients have been cancer patients. And 7 of them had to go into critical care units, ICUs, out of the 18. So 1,572 were the others who did not have cancer at all. only the 18 patients have had cancer. So they have been able to elicit in history from them that they have undergone. Some of them had a chemotherapy a month ago and
Okay.
radiation therapy a few days back. They
Okay.
completed the treatment. So whatever everybody is going to say the same thing. The cancer patients are going to be immunocompromised, and they're going to be at risk for any infections. Okay, at risk for
Correct.
contracting any kind of infection, be it for COVID-19 or any other. So it is
Absolutely.
not that at all. I would, as you said, the fear. Luke also said, fear and anxiety are the main problems. Once we overcome the fear and the anxiety, there is nothing. But fear and anxiety have been created by by the media, and everybody around you are creating it by talking to you about the virus and about the probabilities of you contracting the infection. So that is why these things have come around. The fear has caused all these issues. My immunity is low. Should I do something else?
Yeah.
From medical point of view, we have given whatever is possible, like vitamins and supplements, to give them support, and meditation. I always send the patients to you, and some patients I have advised yoga, and some patients have just be relaxed. That is what though they do not see these people, all of them do not come for whatever we advise them.
Sure.
So we have to go through whatever they like and then bring them back to our line. So supportive care by all these other methods, and the support of their family, the
Mm.
immediate caregivers, ones who are going to take care of them, have also got to be very strong in their mind and say, yes, it is not necessary to be scared of it. We have seen, there is one patient attender, one brain tumor patient attender. She's telling me that she brought her husband who is sick now, and he's undergoing chemotherapy. She's telling me, madam, what is it, madam? I have seen cancer itself. Why am I going to be scared of corona? This way is opposite of it, okay?
Yes.
So she's able to overcome it in that way. So they themselves also know how to overcome this fear
Absolutely.
and this anxiety. The treatment is needed, and so that is the thing that we have to look out for. So I would give them emotional support and vitamin support and nutrition. Of course, Luke is there to talk about nutrition. I don't want to go into his domain, and that's it. I would give them all kinds of counseling needed. If they want, they can always call me, have call, telegram, phone call, or they can talk to me over WhatsApp, message, and be strong till this whole thing is lockdown is over.
Lovely.
Okay.
Yes. Lovely. Thank you. Luke?
Yeah, so I think Dr. Sumana covered that really well. See, there's no point in fear. We have to understand fear and anxiety gets us nothing. It's a human emotion that is taught over and over again, and fear becomes a story and an illusion in our mind.
Yeah,
Like
exactly.
any cancer patient, or like for anyone, what we need to understand is we need to be careful. Of course, if we've just finished a chemotherapy session, a radiation, we got to be careful, but we don't have to be fearful. If we're doing the right things, you're following the advice of your oncologist, your radiologist, you're taking the right nutrition, which is very simple. No superfood stuff, all of that stuff. Very simple nutrition that your body requires. You're sleeping well at night. You're looking after your emotional health. That is the main thing, because today medical science has proven the impact of chronic stress with an increase in cortisol and the impact of elevated cortisol on the immune system. So I don't think we need to worry and fear. We need to be cautious. Let's divert energy from worry and fear into being safe. So, we want to send out our family members, make sure they wear their masks, social distancing, come back home, wash their hands. Basically, whatever the medical fraternity and the government is advising people, we should just follow that and observe the rules of lockdown. That's it, and focus on our mental health. Now we're in lockdown. All our patients have so much more time to focus on their health, on their emotions, on their food, on their activities. So they should look at this as a boon, because if most of them go to work and they don't have the time to put their lifestyle in place, but right now they can do it. So I think fear and anxiety through relaxation, emotional support, I am so happy to, because every time I come across an oncologist, a radiologist, who invests their time in emotional health. Because see, you know, I mean, we don't want to be enemies of any fraternity. At the end of the day, everyone is looking at making human life better. You know, there is research, there is evidence-based research, but when people in their practice realize the impact of emotion on disease, we want to give it some amount of, you know, credibility and put some effort so patients can actually prevent reoccurrences. You know, all my reoccurrence patients are patients who have obviously had low immunity. They finish their chemo, they go back to smoking, drinking, chewing pan, late nights again, and 6 months later, they come back with the cancer because they never really changed their lifestyle or their immunity. So I think it's beautiful, and fear and anxiety, and that's why relaxation and emotional stress. The human mind is, you know, you can just let it wander and it'll go on wandering. We have to be in control with our relaxation practice, our yoga, our pranayama. So we're grounded. You know, our mind may wander, but we will come back to focus on, fine, I have a disease in my body. What's the next option? Have I accepted it? Yes, let me move on. Let me move on with this. And these people recover like this. The people who have not accepted their treatment by the fourth chemo cycle are the ones who are still like, why me, why me? And there's so much of resistance, they can't even accept the treatment. Their bodies are not going to accept it too. So yes, emotional support, mind, body, everything that Dr. Sumana has said is just, I feel so happy at this point, really. I just feel so happy and so privileged to share this platform with Dr. Sumana. And you, of course, Viji, and the amazing work. So Viji, you guys have handled every one of our patients.
Yeah.
I must share this, you know. So I was treating Arjun Rampal's mom, and we flew her down to New York to Sloan's for her treatment. And we met up with the doctors, and then she was like, Luke, I'm too stressed at this point. There's just too much happening. I'm away from my kids. I'm away from my family and stuff like that. At that point, I called up, I think, Dr. Viji or Dolly, and I said, listen, do you all have anyone in New York City? I need meditation to happen for this lady. Within 45 minutes, a heartfulness practitioner came from New Jersey to Sloan's Hospital and sat and gave Arjun Rampal's mom a session. And that was a changing point in her treatment. She just changed after that. She would do the practice every day. So these are things I've seen with my own eyes. And when you see it in experience, we can speak with conviction. When we read it out in a book and try to teach people is very, very different. So thank you to Heartfulness Meditation as well. And for this platform to, you know, connect with Dr. Sumana as well. I just feel so happy right now.
Thank you, Luke.
Thank you, Luke.
So again, we have just a little time left. And so I want to say it's wonderful that the three of us could come together. And without even planning for this, the reaffirmation of our beliefs that it is an integrated system that is actually going to help people get better, and then slowly perhaps move even into prevention, you know, reducing the morbidity, the suffering, and the pain. And we're very, very happy to have worked with both all of the patients that Dr. Sumana has referred, and Luke, all of your clients who have taken sessions from us. And I'm hoping that through this today, many viewers have been able to imbibe the essence, the pillars that are required to support themselves, not just during the COVID time, but going further too, when we go back to whatever is the new normalcy. So thank you very much both for your time.
Thank you.
We're going
Thank you.
stay on and offer the heartfulness relaxation that has a specific focus for cancer patients. And right at the end, just some information before we wrap up. So thank you again, and everybody can join us. So this relaxation is not just for patients, but families, friends, caregivers, anybody who's connected to cancer patients in any way. If you could turn off your mobiles and take the next 10 minutes for yourself. Please close your eyes softly and gently. Sit in a position that is most comfortable to you. We begin with the heartfulness relaxation. Wiggle your toes a little bit and feel them relax. Let the energy from Mother Earth enter your feet, relaxing your feet and ankles. And as the energy travels upwards, it relaxes your leg, your knees and your thighs. Relax your waist, hips, and stomach. Feel the energy going into your back, and from the top to the bottom, your entire back is relaxed. Relax your shoulders and feel them simply melting away. The energy flows into your arms, relaxing your upper arms, elbows, lower arms, wrist, palm, fingers, all the way to your fingertips. Feel the energy flow into your chest and travel upwards, relaxing your neck and neck muscles. Bring your attention to your face. Relax your jaws, your mouth, nose, eyes, ears. Deeply relax each and every muscle in your face. Relax your forehead and all the way to the top of your head. Feel your entire body from the top of your head to the tips of your toes. Be relaxed. For all family members, caregivers, friends, anybody who may be praying for somebody suffering from cancer, slowly and gently move your attention to your heart. Make a prayer for them and stay right there. For patience, slowly and gently move your attention to those organs or areas of your body that are affected. If possible, visualize these organs or the area in general and bring your awareness there. The energy is now flowing into these organs. Let the entire affected area be bathed in the sacred divine energy. Suggest to yourself that this loving energy is healing your organs. Rest here in the awareness that your organs are receiving this healing energy completely. Slowly bring your attention to your heart. Now everybody join together. Feel the love and light in your heart. Let this light and love attract your attention inwards into you, to your heart. Allow yourself to stay there for a little bit more. You can slowly open your eyes, feeling the effects of this relaxation and lightness in you. When we work with our patients and families, the relaxation usually goes into deep meditation and other aspects of the heartfulness practice that are supportive. In general, the Heartfulness Institute's strength is face-to-face sessions with trainers at no charge. But today, with the COVID pandemic, we support all patients online. To know more about our Heartfulness Wellness initiatives, or for any personal queries, or the Cancer Care Program, which is one of support and not an alternative to treatment, you can write to us at wellness@heartfulness.org. You could even locate any of the meditation centers or trainers using the Hotspots facility, hotspots.heartfulness.org. We support you using technology, either on YouTube, the Heartfulness YouTube channel, or the Hearts app, in which you could receive meditation sessions online with a trainer one-to-one. To know more about the science of heartfulness meditation and to receive sessions, we have free masterclass sessions conducted by Daji, the guide of heartfulness meditation. And with the pandemic, we have various programs that are available through the Heartfulness Institute. You can tune into any of these programs to learn more and experience sessions. We're very happy that you could join us today, and I hope and pray that there may be more and more of integrated medicine available to each and every patient to enable healing and well-being. Our next webinar from the Heartfulness Wellness session is on 20th April at 5:30 p.m. IST. The topic is on Serve to Deserve, and the speakers will be Srimati Vatsala Vasudev as well as Mr. Harpreet Ban. We look forward to seeing you on it. Namaste.